4 years ago today, Nebraska confirmed its first COVID-19 case. It was a Douglas County woman who had recently returned from a trip to England.
Since then, we've navigated public health measures and mandates. 6 News' Joe Harris talked with one of our local health officials on how he thinks officials should prepare for any future pandemics.
We're going to start the research right now on tracking where this patient has been.
Nebraska Medicine's infectious diseases chief, Dr. Mark Rupp, remembers when Nebraska confirmed its first COVID case.
How anxious the community was, how this first case, there were some potential exposures at a basketball tournament.
And since that case, the metro saw thousands more. Over 1,400 people died in Douglas County, and stressed hospitals accompanied lockdowns, restrictions, and mandates to flatten the curve. During that time, people lost their jobs, homes, and businesses permanently closed. And since the school closures, students' test scores are down. Did health officials overreact?
We're all geniuses in retrospect, right? I don't think there's a single one of us that regrets something during the pandemic and having either misinterpreted something or gave some bad advice. I think that's true across the board. And if we could go back and do some of these things over, sure, most people would say that there were some mistakes that were made.
While Rupp believes the Public Health Service did a magnificent job, he says the health measures could have had shorter durations and been more precise.
What they were doing in a heavily affected city on the Northeast coast wasn't necessarily what needed to be done in rural Nebraska.
Looking ahead to future pandemics, he has one idea of how to prepare.
The value of improving our ventilation systems within our schools, within our businesses, within our commercial establishments. And, we really should be investing in that infrastructure to improve just the overall health of our ventilation system so that we have less airborne indoor transmission when the next pandemic occurs.
Nebraska Medicine says data analyses indicate that disease-induced immunity can be as long-lasting or even longer-lasting in some instances than vaccine-induced immunity. So was so-called natural immunity discounted early on?
It is something that folks knew about and were grappling with from the standpoint of public health policy. So if you're looking at, what is the best way to get a population immune to an illness, in this instance, vaccination was very clearly a smarter way to proceed.
How effective was the vaccine? According to numbers from the Nebraska Department of Health and Human Services, of the people hospitalized for the virus in Omaha facilities in 2021, 35% were vaccinated.
It doesn't give long-lasting immune protection, and I think that's what the greatest disappointment is. The data does continue to suggest that those folks who are fully vaccinated are much better protected over the long haul than those people who are choosing not to be protected.
On your side, Joe Harris, 6 News.
4 years later, Rupp says we are much better off with population immunity. He says it's partially because of vaccination and transmission.